Good afternoon, everyone. Distinguished guests, colleagues, and fellow students. It is my honor to welcome you to the session of the WGP Conference, creating the Department of Health, Policy and Management of Universitas Gadjah Mada and the Melbourne School of Population and Global Health, the University of Melbourne. We are gathered here today to get a deeper understanding of this academic collaboration, which offer an important opportunity for international learning and research experience.
Without further ado, let's begin with our session, the opening remark from our Dean, Professor Yodi Mahendarata, the Dean of Faculty of Medicine, Public Nursing, Universitas Gadjah Mada. Yes, Professor Yodi, please, the floor is yours.
Assalamualaikum warahmatullahi wabarakatuh. Very good afternoon, everyone. Colleagues from University of Melbourne, Professor Belinda Dawson and Ms. Emma Barnard, dearest faculty members and students. Australia and Indonesia share a long and rich history of working together to address health challenges in both of our countries. From joint effort in tackling infectious diseases, advancing maternal and child health, strengthening health system, pandemic preparedness, our partnership has been built on mutual respect and shared priorities. So today's event is another milestone in this enduring collaboration. So it's a pleasure for me to welcome you to this info session for the double degree program between Department of Health Policy and Management Faculty of Medicine, Public Health and Nursing, Gadjah Mada University, and the Melbourne School of Population and Global Health, University of Melbourne. This is just an academic collaboration, but it's also a bridge between Yogyakarta and Melbourne, between Indonesia and Australia, to prepare generations of leaders in health policy, systems, and global health. It also embodies Gadjah Mada's aspiration to become locally rooted, globally respected, which practically means grounded in our national context while contributing to global health, knowledge, and practice. Now, in today's session, you will be provided with both perspective and clarity. We will begin with overview of Australia's health system to help you appreciate the context, which you may later study and gain experience. And then you will get a more detailed information on double degree program, structure, requirements, and the unique opportunities. So I would like to express our appreciation to our colleagues from Melbourne and also to our faculty members, staff who have worked hard to make these partnerships possible. And so may these collaborations further strengthen Indonesia-Australia cooperation and contribute to shaping leaders who are truly locally rooted and globally respected. To our students, I encourage you to make the most of this occasion, engage fully, ask questions, difficult question, it's fine. We love difficult questions, and envision how this program can help you shape your future as public health leaders who can link evidence with policy, science with action, and local realities with global perspective. And most importantly, use this opportunity to step beyond your comfort zone, challenge yourself to grow through new experience, and to embrace the global stage with the confidence of being both Indonesians and respected members of the international academic community. And on that note, I wish you a fruitful discussion. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Professor Yudi, for your inspiring words and support for the collaborative program. Before we proceed with our further agenda, we would like to give a token of appreciation towards our partner, University of Melbourne. Please, Dr. Lutfan Lazuardi, as a representative of Department of Health and Policy Management, University of Gadjah Mada, and from University of Melbourne, please kindly step forward to receive our token. All right. We shall now proceed with the main agenda, the presentation from the Australian health system. The session will be delivered by Professor Belinda Dawson McLaren as Acting Course Director, Master of Public Health Program, Melbourne School of Population and Global Health, University of Melbourne. Professor Belinda, we are honored to have you with us today, and the floor is yours.
Thank you very much. And we're very fortunate that this presentation will actually be shared Sorry, where should I stand? This side? This presentation will be shared with my colleague, Emma Barnard, who is also from the Melbourne School of Population and Global Health and is the Assistant Course Director, Master of Public Health. So we will both present today. We're very pleased to be here today and to have the opportunity to meet some of you in person. And also we would like to extend our greetings to those of you who are joining us online. Thank you for making the time to come to this session. So the City of Melbourne, we thought we would just start with a few pieces of information that you might know or you might not know about the City of Melbourne. We are the world's 5th best student city, and that ranking was in 2025. We're also the 4th most livable city in the world and in the top 10 of being the safest city in the world. So Melbourne is a wonderful place to visit, but also to come and study and live. We're a very multicultural city. We have citizens from over 200 different countries, and that makes us a hub for culture, music, arts, and a lot of sport. We have over about 3,000 live performances weekly, so there will be lots to do in addition to studying with us in Melbourne. Our public transport allows you to move around the city and come to the university with ease. We have access to trains, to trams, and to buses across Melbourne. Hopefully, many of you drink coffee. Melbourne is a wonderful place and drink coffee. We have many cafes and many wonderful restaurants that's reflective of the multicultural community within which we live. These temperatures, these won't be very exciting for you, but we do have in our summer period an average top temperature of 26 degrees, which is very pleasant. In winter, it does get a lot colder. The average top temperature is 13. We do in Melbourne get down to 0 degrees, 1 degree, degrees in the mornings. So make sure you bring some warm clothes with you. But we're also close to beaches and you can undertake skiing and other activities. So just to show in another way that we, at the University of Melbourne, which is situated within the City of Melbourne, we are number 19 university in the world and ranked number 1 in Australia. We have over 65,000 current students enrolled with us at our university. We'll go to the next slide. And so this is where our university is located. Some of you may have visited Melbourne previously and perhaps visited the university campus already, but we are nice and close to Melbourne City Business District, as well as the biomedical precinct in Parkville. And you can see just at the top of the screen there, a little glimpse of the bay. Our school is the Melbourne School of Population and Global Health, and we are Australia's leading school for public health. We're committed to fighting inequality in health outcomes, and we do this through excellence in research and higher education, taking evidence-based practice and using it and advocating for implementation into health systems so that we can seek better health for everyone, locally as globally. Within our school, we have 7 centres and institutes within the school, and we had a discussion a little bit earlier with some colleagues here, and you already have some connections to some of those centres and institutes. With over 450 staff, we are very active in our research space as well, 150 PhD students, and together they're producing 1,500 research publications per year. So a very active school. Here is some photos of some of our very dedicated and excellent teaching staff, and you may see Emma on the slide there already. So it's now my pleasure to hand over to my colleague Emma Barnard, who will speak to you about the Australian health system.
I've got one. Thank you. So wonderful to be here today to speak to you. And I am going to just give you a very brief overview of the Australian health system. So we'll stay on this slide for a minute, and I would like to draw your attention to this image up here. And I'd like to ask you, what is it about this image that you think, what do we see here? It's a yes. What else? We're getting very close to the answer that I'm after. Half of our population is down below. Where specifically is most of our population? Up here? Down here? Yep. So on our east coast, absolutely, most of our population resides on the east coast. Most of our population in Australia resides around the edges. So we're a coastal country, and our population is largely centred around the coast. We have a vast expanse of land in the centre, and of course there are people who live across the country, but really our population is centred around the edge. Now this here, this group of gentlemen many years ago were the people who divided our country up into or provinces. So originally when Australia was settled, was colonised, we were independent territories which were federated in 1901. So a small part of Australia's history here, which has really profound impact on our health system specifically. So you can see here we're a federated nation of 6 states and 2 territories, not forgetting Tasmania down the bottom here, which poor Tasmania often gets left off the map and often gets forgotten, but we should never forget Tasmania. So we're a country that is shaped by our geography and our history. We could go to the next slide, please. And just for comparison, I tried to overlay a map of Indonesia with Australia to sort of give us a sense of scale here. I don't know whether I was totally successful at this attempt, but really, I thought that was an interesting exercise. So if you go to the next slide. So here we have bit of an infographic that tries to capture our health landscape. So another way of thinking about our health system. And if I just take a minute to step you through it, if we sort of look at this, looks like a bit of a cake, perhaps like a layered cake. So at the bottom of our layered cake, we have those founding levels of things that impact our health system. So determinants of health, which I'm sure as public health students you are all familiar with, and other demographic factors that have an influence on our health system. So things like education, employment, income, the way our families and communities are up, whether we live rurally or remotely, in our Indigenous Australians, of course. Then thinking about this second layer of our cake of our Australian health system, we can see prevention, so preventative health efforts centred here at the bottom of our health system. So they really underpin our health system. So things like cancer screening and tobacco control, physical activity, food, immunisation. Again, as students of public health, I'm sure you're all extremely familiar with health promotion activities and disease prevention as a concept. So our sort of middle layer here, primary health and community care. So this is the first access for most Australians in our health system. So this is where we access primary care, general practice, allied health, pharmacy, dentist, our primary health network. So across our country, we are also divided up into primary health networks, which really support the work of general practice, community and preventative medicine. And also aged care. And at the top, we've got our secondary and tertiary hospitals, so both public and private, specialist services, diagnostics, pathology, local health networks, and residential care. And you can see down here, we've got our group of community individuals who all access this layered healthcare system and those other elements that input our health system. So things like being very important, supporting regulations and infrastructure, so workforce, research, data analytics, information technology, quality and safety, and some opportunities and challenges here too to think about. So some existing issues that we are grappling with as a nation in our health landscape. So we have an ageing population in Australia, which has a big impact, the impact of technology, chronic disease and consumer expectations too. So a nice sort of representation there of our health system. Good. Thank you. So I'm going to draw on the WHO, some of the WHO building blocks of health systems here and walk you through some aspects of governance and leadership which impact the Australian health system. So again, thinking back to that image before of our federated nation of different states, the responsibility for governance in terms of our health system is shared between the federal and state governments and also local governments too. So broadly, national, federal, Commonwealth government funds primary care, so all of those primary care and preventative health services and general practice. We have a universal health insurance scheme called Medicare, and that supports access to primary care broadly. Acute care, so tertiary care, is provided in public hospitals overseen by state and territory governments. So state governments in Australia really do run the hospital system and also private hospitals too, and the federal government does contribute some funding for public hospitals. A proportion of the costs of acute care is paid by Medicare, so our universal health system, so publicly or government-funded hospital stays, specialist services, radiology and pathology. So all of these sorts of services that you would access in a public hospital are funded by that universal insurance scheme, which does sort of make the delivery and fund arrangements of our health system somewhat complex. Thank you. So what does our federal national government, what are they responsible for? They are responsible for medicines, vaccines, therapeutic devices through regulatory agencies. So Therapeutic Goods Administration agency, for example, make decisions about which drugs are funded and eligible for government subsidies. They also make decisions about our immunisation programs, so which vaccines will be supplied at low or no cost to Australians, but the rollout, so the delivery of our immunisation programs, occurs at the state level. So funded by the Commonwealth, but implemented at the state level. The federal government is also responsible for health system services for Indigenous Australians. So Indigenous Australians can access the Aboriginal community controlled health sector, which sort of sits parallel to our health system, but specifically for Indigenous health and welfare. Dental services for young people and basic dental services are subsidised by the federal government. Hearing services, all aged care, residential and assisted living is also a federal government responsibility, and some mental health programs, for example, the Better Access Initiative. So this is actually a program that's run through Medicare, whereby people can access subsidised mental health support. So these are the sorts of things that the federal government in Australia regulates and are responsible for. So other areas too, war veterans health, regulation of health insurance, medical research through the National Health and Medical Research Fund, national coordination in the health emergency. So this most recently demonstrated during the COVID-19 pandemic. Primary health networks, I mentioned those before. These are about planning, access and coordination of healthcare, so general practice services broadly. Health workforce education, so university places for different health professions have subsidies in place to develop and contribute to health workforce in Australia. And very new is our Australian Centre for Disease Control. So this is still a bit of a work in progress, but really was an agency that was created it was been on the cards for a very long time, but really cemented after and during the COVID-19 pandemic. Okay, so what then, going back to our state and our territory governments, these regulate and manage and fund the administration of public hospitals. So again, parts of public hospitals and services are funded nationally, but they're all administered at the state level. So prevention, most preventative health efforts are concentrated at the state level. Community health services, acute care mental health services, ambulance and emergency services, infectious disease control, food safety, environmental health, those quality assurance measures important for monitoring health premises, safety and quality of healthcare services, including consumer health complaints, are all operated at the state level. And then I think we have the next slide, which is our local government. So again, 3 levels of government in Australia: federal, state, and then local governments. So local governments do play a role in our health system, and they're responsible for things like planning regulations, health promoting and spaces. So local governments take control and administer, building of parks and parkland, buildings, gardens, streetscapes, municipal planning initiatives, food safety monitoring and reporting, the delivery of immunisation programs. So I said before, the federal government makes decisions about which vaccines they'll fund, but these are all delivered at a local government level. They also administer waste and other environmental services, home and community care, although this is on the decline, it's increasingly less so. So there are some aspects of our health system that also have where the state and federal government have a shared responsibility. So I've said before that the funding of public hospitals, some of that comes from the federal government, some of that comes from the state government, all administered by state governments. So screening services such as for bowel, breast cancer screening. The shared responsibility is also in place for accrediting health professionals. So those professionals through the Australian Health Practitioner Regulation Agency. Palliative care services are a shared responsibility, as is the National Disability Insurance Scheme. So this is another insurance scheme that funds care for mobility supports for people. Mental health and suicide prevention agreement is also a shared responsibility, as are emergency responses and some health advice and referral telephone services that are available too, with some examples there. Okay, so financing. How much do we spend on health in Australia? It's a lot. It's 10% of our national gross domestic product, ranked 15th in health spending in the OECD. Does anybody know who spends the most money on health in the world? Does anyone want to? It's the United States, would you believe? So in Australia, the government is the main contributor here. So 75% is contributed by governments. But then we have about a quarter of our health budget comes from non-government private sector sources, including not-for-profits and philanthropic funding too. So the large portion of this is spent on hospitals in Australia, with just over a third spent on primary care, largely through our Medicare system, but both areas increased sort of in the last couple of years. The money that is spent comes from tax revenue for the large part in Australia. And here's a question. So growth in spending on health over the 25 years has exceeded growth in both our population, the economy, and takes into account population aging. So our amount of money that we're spending on health has exceeded growth in all of these areas. Why do you think that is? If we factor in an aging population, which we know will cost more to look after, healthy lifestyle, I think that we have an expectation in Australia that as we age, we should be healthier and healthier for longer. And in order to be healthier over the longer term will require investment. So that does cost more. I think that's part of the answer there. Non-communicable diseases, I think, and the interplay of comorbidities, so chronic and complex care, absolutely probably have something to do with it, but it's not quite the answer that I'm looking for. Yeah, yeah, have a. That's a great answer. Have a prize for being brave. And if you flick on to the next slide, I think, well, no, I haven't got it up there, but the answer is it's about increasing costs in terms of new technology. New technology is expensive. So the more we are able to access new technology, it costs more. There's also the expectations of consumers, sort of people as patients expect to be able to access these new and expensive technologies. So it's about sort of there's part of this question that's about consumer expectations as well. So I think it's a really interesting problem for us. So our Medicare, our universal health insurance system, provides free or subsidised access to primary care for the most part in Australia. When you want to go and see a general practitioner, you pay either no cost or a low cost. There's a low co-payment for accessing primary care because the rest is funded through the Medicare benefits schedule. Treatment in public hospitals is free, and this is funded through a 2% levy on most taxpayers. So earning above a certain threshold in Australia, you pay a 2% levy on income, which funds our public hospitals. And there's a surcharge for people who don't take out private health insurance. There is a mechanism which we are all encouraged to take out private health insurance to help cover some other costs. And for those people that don't, they are taxed at a higher rate. Some other public insurance schemes, I've already mentioned the National Disability Insurance Scheme, the Transport Accident Commission. So if you have if you are injured in a car crash, or if you are injured in by public transport on the way to work, you are eligible to access the and have some of your care paid for by this insurance scheme. We have a similar insurance scheme for workers' injuries. Those are both, last two are both state run. Significant Medicare reforms in Australia a couple of years ago. So this is really a big review of everything that the scheme kind of covers and pays for. And this is reviewed sort of on an ongoing basis too. So we do have private health insurance in Australia. As I said, there's a tax mechanism by which we're encouraged to take out private health insurance to help pay for care if you want to get care in a private hospital, for example. Just about half of Australians have private health insurance. And these also cover some of the cost of ancillary services like dental, physiotherapy, that sort of thing. What else can I tell you about private insurance? It covers private hospital use and may pay for a private room in a public hospital because confusingly that exists. And it can also cover you having the choice of your own doctor in a public hospital too. It can provide faster access to some procedures, although not always. And like I said, there is a mechanism that we are encouraged to take out private health insurance through our tax system. We will get taxed more if we don't have it every year after we turn 30. So just a little bit now on surface delivery, which I've already sort of been talking about. And again, just going back to our cake here to remind you what it looks like. And we've got sort of preventative care, primary and community care, and specialist and acute care at the top. And you can go to the next slide. So the types of health services, and I've been talking about these already. Primary care, so first point of access for most Australians, typically delivered in the community. Secondary care looks like specialists in private practice, and then acute or tertiary care. So for more complex, severe acute health conditions, this is usually delivered in the public hospital system, but also includes services such as transplantation, also emergency services. Rehabilitation and aged care services are delivered separately and specifically, as are palliative care services, mental health care, allied services. I said before, Indigenous health is delivered through the Aboriginal community controlled health sector, which operates across all jurisdictions. Women's health services, maternal and child health services. Then we have our health departments. So this is where we see our public servants being and administering part of the health system. And some of this looks like epidemiology, so tracking, monitoring of disease and illness. And then we've also got non-government organisations who also deliver specific healthcare services for specific conditions or in specific populations as well. And then to note on our preventative health services, I think we can all agree that this is where we should be probably spending more money, but we don't. So preventative services in Australia, we've got good national cancer screening programs for bowel, breast, and cervical cancer. Also fund promotion services, so things like healthy eating, physical activity, health promoting environments. These are generally delivered by government, community health, through schools, and by non-government organisations too. And our clinicians also have a role, sort of in their one-to-one conversations with patients to delivering these preventative health messages. And just a quick couple of slides on our health workforce, just to give you a sense of the scope, which pales in comparison to a country like Indonesia. So our total population in Australia was just over 27 million as of 2024. And these are the numbers of the different registered health practitioners. So if you are an accredited profession like a doctor or a nurse, or a dentist, a dietitian, a psychologist, these are all registered health professions that people need to have accreditation for through the Australian Health Practitioner Regulatory Agency. So we know the numbers in Australia here, so you can see how many of the different professions we've got working across different disciplines in Australia to service our population of just over 27 million people. And just going back to my initial point about the distribution of our population in Australia and how that impacts service delivery and health workforce in the country. So because, as you rightly pointed out, our major cities are dotted on the coastline for the most part. Cities and the edges of Australia are very well served by healthcare providers. However, regional and remote areas do have poorer overall access and fewer health workers sort of working across those areas. So if you are not living in a coastal city in Australia, your healthcare access is more difficult, and our health indicators reflect that we have poorer health outcomes once you start moving sort of inland and away from those coastal areas. And those outer regional rural areas have the poorest access healthcare in Australia. There we go. And again, so just to remind you of the of the population distribution around edges of the country too. So again, a nation shaped by geography and history. And I think that might be me done. So very, very, very quick overview of what the Australian health system looks like.
Thank you, Emma. And any questions for Emma, please hold them and we can discuss them in the panel as well that we're going to move to shortly. Just before we do that, though, I wanted to share a little bit of information about studying public health in Melbourne, and this will help to frame and inform some of the discussion that we are about to have. So the Master of Public Health at the University of Melbourne, this is an opportunity to embark on a transformative career and to be prepared as a leader in public health. And we do that through a blend of coursework, real-world practice, and also the opportunity to participate in research. And that equips you with skills to tackle current, but also really importantly, future health challenges, because we don't quite know what is coming up. So the Master of Public Health is an internationally recognised program. We have a wide range of subjects and a lot of flexibility in course planning for students. And as I said, we are very focused on thinking about preparing the workforce and initiating and generating careers in public health and developing skills. The structure of the program, and this again will be helpful for our conversation coming up with the panel shortly. We have 6 courses that all students will take as part of the Master of Public Health, and we have about 60 electives that you can choose, and that's a very large and overwhelming choice for students. So what we've done is grouped them into specializations. So we have 11 specializations or areas of interest, and some of our electives span multiple specializations. So you might choose to study electives that fall within one specialization, or perhaps choose electives from across a number of specializations. And you can see here listed the 11 specialization that we have. Towards the end of the master's degree, every student takes part in a capstone experience. And there are 3 options or that you might take in that capstone. So one of those is to undertake a public health research project, and that involves analysing to do with public health and writing up a research report. Another option is to undertake a placement or an internship experience, and in that you would be immersed in an organisation that is delivering public health practice. You would learn from people who are working in the area and be exposed to all the ways that they conduct their activities. And students will write up a report, again, of their experiences. The third option is an option where we bring public health experts into the subject, and they will tell you about a broad range of areas of public health and expose you to different ways of working and different ideas in public health. And within that program, you have the opportunity to create a proposal and develop an idea around tackling some of those public health challenges. So who's the Master of Public Health at Melbourne University? Well, our students are very diverse in their background and also where they come from. This map here was from a group of the incoming cohort of students this year, and we asked them in our orientation to let us know and let each other know where it is that they've come to study with us in Melbourne. And so those green pins indicate where they've come from. In our program, we have new graduates, and we call these students as being career starters. And these students are looking to become part of the public health workforce. We also have people called career changers. So people who already have started a career and they have been exposed to some ideas around public health, wanting to move their career from what they do now towards the public health area. And these might be people who work already in clinical or scientific settings, or even in the private sector. Very excitedly, though, we have this third group called career enhancers. So these are people who are already working in public health. They might be working in government or non-government organisations, and they are looking to elevate their career and enhance it further. And what this means is that within your classes and within the cohort of students, there is a very wide range of experiences and perspectives. So although you learn from the teachers, you also learn from others. Where the previous study that people might have undertaken or the areas where they might be working prior to coming into PH are listed up here. This is not everything, but what it demonstrates to you as well is that there is a very wide range of students and experience coming into every classroom and participating in every discussion. We might have a video. We wanted to show you as well to hear from one of our graduates of the MPH, Tanya, who graduated in 2023.
University of Melbourne. I chose Melbourne because the subjects were truly aligned with my areas of interest, and they also offered the skill set that I need for my personal and professional development. I graduated from MPH in July 2023, and I'm currently undertaking my PhD at the Nossel Institute for Global Health. My PhD is looking into young mothers' access to and navigation of health and social services while situated on the street of Yogyakarta. My MPH has prepared me for a global career because the course structure can be applied to many different global contexts.
Next slide. So it's very important to us that students within our program not only receive excellent education, but also have a wonderful, rich learning experience. And so we have supports for students to connect you in with your peers. And one of these critical components is our Global Health Students Society. And this is a very vibrant society. They run lots of activities, and I would encourage anyone coming to study with us to engage with this society. And what they will help to do is run events where public health speakers are invited to talk about, but also to give career information. This society also organises student conferences, so you can have an opportunity to learn from each other. They help out and support students at orientation. They run social events such as film nights and trivia nights. We also have some structured mentoring programs within our school, and this is to connect first year and second year students, but also current students with alumni, because the cohort that you study with and the peers and the network that you make as a student, that network will continue to be really important as you go forward in your career. Speaking of careers, where do people go, or what do they do after they finish studying with? We have just a few examples here. So just to read out a few, for example, we had a pharmacist come in and study our program. They are now working as the Assistant Director for the Chief Allied Health Officer, and this is in our Commonwealth or National Department of Health. We've had a science graduate go on and train to be an epidemiologist. So there is many and varied career outcomes for students who take our master's program. And just finally, wanted to show you a photo, and in fact, there are some graduates in this room as well. We have a very impressive set of alumni from our program, but in particularly Indonesian students who have studied with us. And we're very impressed by the work that they now go on and do. And this photo on your right was us out at dinner the other night in Jakarta, catching up with some of the alumni from the program there. So just to finish off, you might recognise the Sustainable Development Goals along there. And just like to finish, I suppose, with a call to action that never before has there been a more important time to consider studying and working in public health. Every day, every week, every month, every year that passes, we need to be closer and closer to achieving these goals. And we can do that by working together. So thank you.
Thank you very much, Professor Belinda and Emma, for the interesting presentation, especially about university life in Melbourne and then the Australian health system. Now we will come to the highlight of today's event, is the talk show panelists between the University of Gadjah Mada and University of Melbourne. This session will allow us to gain further insight about the structure, the benefit, and the experiences of this program, guided by our distinguished panelists. Allow me to introduce today's speaker. The first is Professor Belinda Dawson McLaren, as the Acting Course Director, Master of Public Health Program, Melbourne School of Population and Global Health. Please be seated. And our second panelist is Emma Bernard, the Assistant Director of the Master of Public Health Program, University of Melbourne. And then from Gadjah Mada, I allow Dr. Lutfan Lazuardi as the Head of Department Health Policy and Management, Faculty of Medicine, Public Health and Nursing, University of Gadjah Mada. Last but not least, I present Dr. Lika Prawidya Putri, lecturer from Department Health Policy and Management, Faculty of Medicine, University of Gadjah Mada. This session will be conducted as an interactive discussion, and there's a follow-up question and answer segment. So feel free, if you have questions, to raise your hand at later session. And for online attendees, you may type your question in the chat box, and we will address that later. And then we can please begin the discussion. Is there any more mic?
Yes, they're just on the desk there.
Okay, we begin our discussion with the first question. I would like to direct to our colleagues from Universitas Gadjah Mada. From UGM perspective, why is this double degree program important for our student, and how does it contribute to the health policy development in Indonesia? Maybe Dr. Lutfan, maybe you perhaps start.
Thank you very much for the questions. I think we really would like to prepare the next leaders, which is equipped with. We know that UGM has a strong foundations and the impact on the health system in Indonesia, but of course they would like also to be exposed with the international experience. And this is, I think, the reason why we collaborate with the University of Melbourne to do this double degree. And of course, that to be the future health leaders, we expect strong foundations with this work locally, but also have the capacity and also the experience internationally with this. I think will be also very important experience, and also the practice that we can actually learn from the University of Melbourne. And as we know that University of Melbourne has been actually ranked top level in the world, which is, I think, one of our benefit to have a presence with you.
Thank you very much for the explanation. Dr. Lee, may you have something to add?
Thank you. So just like Professor Belinda mentioned, it's transformative to your career. So I think besides thinking of our health system or health policy, you may think about yourself, about your career, about your. So joining this public health, I myself was an alumni back then in 2012, and maybe some of you are have medical doctor degrees. For many students, as a medical doctor degree graduate, you want to be a specialist like a clinician, pediatricians, or something else. But just like Belinda said, it's transformative, at least for me, because by then I learned a lot about public health and Australian health system, just like you have seen in Belinda and presentation, is very good. Like, it's too good to be true, even for me. I mean, if you looking at the health systems in United States, you can see a lot of inequity and a lot of problem, but the social problem. But when you look at Australia, it's so good, like too good to be true. So you can learn from the best out there. Australia is one of the country that use the plain packaging for tobacco, where other countries haven't done that, but Australia have started that. So I think that's one of the strongest health promotion in tobacco back then. I mean, at least 12 years ago. And the insurance system is also the top notch compared to many high income countries. So you can learn a lot about that. And the other thing is what transformative is that you will be exposed to various culture. I mean, like you don't there you will meet many students from many countries, and then you can share the cultures. You see the diversity. I think that diversity can do a lot of improvement to someone's value, to someone's perspective. And yeah, that's important, not only for health policy and management, or health policy or system in Indonesia, but you can think about how you can develop yourself in the future.
Thank you very much, Ratli. So this double degree program with, of course, will have more experience nationally and internationally. So now let's hear from our colleague from Melbourne, Professor Belinda. What makes the Melbourne School of Pollen and Global Health special, and why would students from Indonesia would enjoy studying there? Maybe you can explain more in the presentation.
Be my pleasure to. And I think it really builds on, Alika, what you were just saying as a student and as an Indonesian student who has studied in our school. We have a very sort of strong history and a strong reputation in our teaching and our research. And what that means is that our school has experts who are really making an impact on tackling those public health challenges that are affecting local communities, countries, and also globally. So our school has a very active teaching and research component, but we also have a very diverse range of students. And I think that is one of the things that makes studying at our school a very rich experience. And for students coming from Asia, you will find that you're studying with other students from Indonesia, but importantly, you're studying with students from all over the world and really having a global experience while being with us in Melbourne.
Thank you, Professor Belinda. Okay, now for Ms. Barnett, Emma Barnett. So from the university perspective, what qualities and strengths does the Melbourne look for application in this program?
One of the things that I say about our very engaged and top performing students is about how proactive they are. They are really proactive. So making sure that you are across what the opportunities are and that you are sort of engaging with us around those opportunities. I think it's important for students to be passionate about public health, sort of in wanting to really make a difference. I think we can all agree that public health is one of the ways we can make a really profound difference, scale in the world, which is why we're all here, which is why we do the work that we do. So we're looking for students who share that vision and those sorts of aspirations.
We were at the Meet Melbourne event yesterday. The student asked me a very similar question, and my advice to them is the characteristic that is that will stand you in the best position to succeed as a student. And what you should be demonstrating as an applicant is curiosity, which is exactly what Emma was just talking about there. Come to us wanting to learn, wanting to ask questions, wanting to challenge ideas. Those are the applicants that we're looking for.
Well, I hope our attendees participant will have good news because they're very elated to study for the University of Melbourne and have more experience. Now, for the technicalities, maybe this is a question for the UGM. What are the main requirements for applying this program through University of Gajah Mada, and can you walk us step-by-step process? Maybe how, when the registration is, and then what to expect until the acceptance. Dr. Like, may I invite you to respond? Thank you.
Okay, thank you. So for the procedure, I cannot remember entirely correctly. So one of the things, so if you want to join this double degree, you need to enroll to both courses in MP at Melbourne Uni and Health Policy and Management at UGM. So what do you need to register to Health Policy and Management from UGM? You can in our website the requirement syarat-syaratnya. So the apologies, I'm talking bahasa Indonesia. Jadi beberapa syaratnya itu ya syarat-syarat dasarnya misalnya ijazah, terus ada syarat bahasa Inggris dan lain-lain. So you're gonna need your so you need your bachelor degree for sure. So if you have the bachelor degree in health, anything actually, medical, nursing, nutrition. And nutrition and maybe public health, Bachelor of Public Health, and any health related. I think M is included in her slide as well. So with that degree, and you need to have the certificate of English competency. It's not only ITP TOEFL, but you can use ACCEPT. So you can check our website, and the gelombang pembukaannya apa ya? The opening for the registration is I think it's 4 times per year, so it can be done in I don't remember the exact timeline, but there will be 4 times of opening for the registration. I think that's all from me. Yeah, maybe Pak Rusman want to add something or.
Yeah, I think all the informations are available. Usually there will be also usually there will a call center that in case that you need more informations, then it's always possible to contact us. So I think that's all. And informations of this requirement is also quite straightforward, that you can actually have this all from our website as well.
Okay. Now, for incoming student that have finance content, maybe is there an opportunity for like a scholarship or tuition fee that was given to the future applicants?
So there is an opportunity for scholarship from LPDP scholarship. So LPD scholarship, so our degree program already included in the LPDP booklet. So I mean, we are official in LPDP booklet since last year actually. So the first one is the LPDP scholarship, but we are in process in developing 2 other scholarship. But it's bit challenging to get there. So at the moment it's LPDP scholarship. Yeah, and I don't know, do we have? Oh no, we don't have any from our university. The important thing about LPDP scholarship is the opening timeline is a bit different from our department. So you have to make sure that you are enrolled in the LPDP scholarship scheme first. So the timeline, it usually open twice a year. On the deadline is on February and September or August. So it's better to apply the one at the January or February, so you can get earlier assurance of getting the scholarship, because the February scholarship, the announcement is only there by June. Yeah, so it takes time. So it's better if you apply early as early as possible.
Okay, thank you so much for the informative explanation. So for our attendees that is interested to apply for this program, please feel free to contact or find the information on the booklet. And if you have financial concern, don't feel too bad because we have a special scholarship from LPDP, which you can use. Okay, now we are proceed to the question and answer section. I would like to invite the audience. If you have any question, please raise hand. Our technician will help you. Okay, we have one. And for the online participants, you may type your question. I see some question, but we'll address them later. Okay, please introduce your name and state the question. Thank you.
Check. Thank you for the opportunities. My name is Tasha. I'm just a fresh graduate in last years, and it's not a difficult question, but I'm just need more description about how
University. For the double degree, the structure is a little bit different in terms of what's available in that capstone. Did you want to speak to what's available?
Oh, yeah. Thank you, Emma. So what's available is only the thesis. So there are two or three capstones. Sorry, I forget. Do you have three?
We have three options.
Okay. So only the thesis. So not the internship or the professional placement. Yeah. So only the thesis for this scheme.
Yeah, I think it's essential for us to provide more context. Like beyond the program, why like Indonesian students could not take, for example, the internship or placement, because as far as I know that if you are going to have placement within the Australian healthcare, you need to be registered as the healthcare professional, and then you need to take credit. Is that correct?
For the Master of Public Health in Melbourne, the placement or internship program, you don't need to be registered. It is more like a work experience or a shadowing experience, different to, for example, the internship scheme that you would do in your medical training, which is where you would be seeing patients, performing procedures, and you would need to be registered. So within the Master of Public Health at Melbourne University, it's a smaller program, 20 to 30 days experience. With the double degree program, because we're managing the structure of two programs, and we've created a study plan that allows students to take subjects from two different universities, we have set the capstone as being a research experience.
You may ask the question.
Yeah, okay. Thank you so much for the opportunity. My name is Dianti. I'm from the clinical student in UGM. I see that you have plenty of elective specialty courses that we can choose. I think it's over 60 or something. And if you could recommend a few that maybe you think have developed the most in your university, or which one that you think have the most development or researches, which one would it be? And I also want to ask about the capstone experience that you've mentioned. How long will it going to take? And is it going to be able to be done parallel with a thesis? Okay, thank you.
Thank you. I might answer the elective question and then leave the capstone question again to the UGM team. We certainly can help with the selection. And in fact, what we have done in the double degree program is we've worked together across the two universities to curate a smaller list of electives that will fit very well within the study program of the double degree. So we have selected electives that complement the core subjects that you do across the other semesters at both the universities.
Well, when we actually started to discuss this double degree, UGM has not yet regulations related to the capstone at that moment. But I think last year, 2024, at the end of the 2024, the rector released the regulations that now there are several possibility for the thesis format, which is actually not the thesis that as we do before, but it can be also like a through capstone project, professional practice, and also probably other documents that allow us to finalize the study. But now, well, probably then we will have a discussion further, since that we have new regulations that allow us also to do capstone project. But at the moment, the scheme is what we have is still thesis. But of course, that we probably need to discuss more to facilitate the possibility also for the capstone project. Yeah.
Okay. Yeah. Thank you for that. So maybe for the capstone project and the thesis is still very flexible. If you are interested, maybe you can email or asking, right?
We can soon also agree on that, because now UGM is also allow us to do this capstone project as the final project of the study. Yeah.
Okay, thank you. Now we proceed to one more question from Ivan Mendrova. The question is it possible to join these programs and still working as a medical doctor? Maybe you mean like online program or something? And then is there any scholarship? Oh yeah, in this double degree program, you can do the scholarship with LPDP schema. Okay, so for the first question, maybe Pak Dr. Lazardi can answer.
Yeah. Unfortunately, this scheme is for on-site students, so you have to be on place at UGM as well as at the University of Melbourne during the study. But yeah, hopefully in the next future, then we can facilitate the hybrid or the online scheme. But at the moment, it's for the on-site study. Yeah, which is probably for those who still do clinical practice, it might be very difficult. But we expect actually that the student have hands-on experience directly in both country. Yeah.
Okay, so for the moment, it's only open for full-time student. Okay, the next question from Jessica Vivian Purnomo. I would ask, may you explain about the course structure in this double degree? What is the course difference between the UGM only and UGM with UniMelb only for Master of Public Health degree? Thank you. Maybe the UGM first and then the Melbourne.
I think it will be helpful if you can the slide.
That's a great question, and we've prepared some slides in advance. No, others.
You get to you have many streams like epi and bio streams, international health or global health streams, and also I cannot remember everything, but and also health policy stream. So when you study double degree at Melbourne Uni and UGM, so it will be mostly about the policy and management. So you can see here, so in the first semester, students will be studying at the Gajah Mada University, as you can see in the slide. So there will be the core subjects related to health policy and management, like health financing, information, health service, policy and management, epidemiology. So that are four subjects. And then at Melbourne, you have to students have to do the the core courses. There are 5 of them: foundation, public health, qualitative research, public health leadership and management, and also another in the third semester, prioritizing and planning in public health, and biostatistics. So the elective courses, like I mentioned before, so for the full-time MPH students, you get to choose several streams. So there are health economic streams or global health streams. So say if you're interested to the health economics, you can choose the electives of health econs or economic evaluation and so on. So in the difference is what are the subjects that you can take at the Melbourne Uni. And well, if you join this the double degree with health policy and management, so you get to learn more about health financing, about health service policy and management in Indonesian things, and also about you can choose about the global health. We have that course as well, and healthcare cost and insurance premium analysis. I think there are the key differences of the subjects that you can learn. Maybe you want to add something.
Thank you for the answer. Next question, almost the same, from Fabian. Hello, I'm Fabian from Fast Track Student, HPM Batch 2025. Can I join this double degree program, but my study time still the same with the Fast Track program, or thank you?
What we actually discussed also today, whether the existing students that enroll in certain program may actually move to other. But since that the fast track is required, that it's only 1 year, and it seems it's still not possible to move to this because I think the requirement is somehow different, and also that the duration of the study, somehow is still it's still now on the discussion also how then to adjust 1 year to complete the curriculum in third country, which is now we still think of the possibility to move from the existing to others. But we'll inform if there will be a new informations available. But at the moment, for the fast track, it's still not possible to move to others. But for the regular, I think since that regulars require 4 semesters, then it might be possible also to move to this scheme. Yeah.
Okay, I hope that explain everything. Now, for the two last question from Andika Wiratama. If I enroll in this double degree program, will I automatically be registered at University of Melbourne, or will there be another assessment process before starting the study at University of Melbourne?
That's right. Pertanyaannya gimana? Jadi apakah berbeda antara?
Apakah kalau saya daftar double degree ini otomatis udah enroll ke Uni Melbourne atau harus daftar
You
juga?
have to register to post university, and it requires different requirement as well.
So the process is you would apply to UGM first, and then your application would be provided to Melbourne University and assessed, and an offer would be made together at the start of the program. You would have entry into both programs.
But there only one way to enroll in the UGM. Not maybe.
I think it's different. I mean, the students, the prospective students, you should enroll in different websites. So Melbourne Uni, you have the website from the registration, right?
Yeah.
And so to register to Melbourne Uni, you have to go to the Melbourne Uni site. If you want to register to MHPM here, you have to go to our website. So it's a different process. Yeah, to my knowledge.
And applicants to the double degree would be supported by us for their application to first UGM and then to Melbourne University. So please, if you are interested in enrolling in this double degree, please be in contact so that we know that your application is coming in, and we can know that the letter of offer from UGM is forwarded to Melbourne University with your application to then be approved.
Okay. So right. Like from the brochure, you have to apply in 2 different university and all the requirement from both program, and then don't forget to write that you apply for this double program. Okay, now the last question is not last question. There are more questions. From Endah Arianti, I am a pharmacist. Am I eligible to apply for this double degree program? Yes.
Yes. Thank you. Yeah. You're eligible for this double degree program.
You would also need to ensure that you meet some of the other eligibility around your academic performance in your pharmacy degree or your previous degree, as well as the English language requirements. But in general, yes, very well.
As long as you met the requirements, then everybody could apply. And then last question from Surya Wijaya. I want to ask about, is this scheme for LPDP scholarship for this program? And how about AAS for this program? Or maybe he asked about the different scholarship. From the LPDP, we already explained. Maybe you want to explain something more?
Oh yeah. So for the LPDP scholarship, we LPDP scholarship over scholarship for selected a double degree program. So our program is one of those. But for the Australian Award Scholarship, I think they have a different program, so not this one. So to be so in short, you cannot use the Australian Award Scholarship to apply to our W. That's my knowledge. I don't know. Do you have any other thoughts? Maybe Emma or other fun?
Well, I have to check about this Australia Award scholarship, but at the moment, our program has been actually listed LPDP schemes. But of course, that if you have other fundings that allow you to do this, it's also possible. Like usually, organizations such as hospital, they may also actually have their own funding that can be also supported to do the study. And this is also actually welcome. But related to the Australia Award scholarship, I probably have to have a look. I don't know yet about that. Yeah, we'll inform you then. Yeah.
Yeah, I think it's a good idea. Maybe you can check the Australian Award Scholarship scheme because it has a requirement. I think they clearly mention what kind of study that are covered under their scheme. Although there are new split side master, but we haven't. This program haven't been included in that split side master.
Okay. I hope that answered the question about scholarship. Next is from Rati. I am really interested with this double degree program. I'd like to know, is this possible to join for the next year? Because the registration was open until August 2025. Thank you.
So the question is, the student wants to
maybe
register on August for which one?
Oh, so the registration open until August 2025, but maybe this person want to apply next year.
Okay, so the registration to Melbourne Uni.
Is it double degree program? Maybe haven't graduated yet or still working. Maybe she wants to. Is it still available, this program next year?
Yeah, sure.
Yeah.
Sure. It's still available.
We have this long-lasting collaboration, so
Yeah.
then it's still possible. While you are studying to finalize your undergraduate program, of course, that you can always have consultations with us to prepare your next term if you would like to. And usually, like LPDP have 2 term to apply on each year.
February
as well as
August.
July and August. Yeah, July or August.
Yeah. So if any interested applicant viewers here wants to know more about this, you can check the. I don't know, Mas Dimas, do we have the contact of our registration admin here? No. Okay. Yep. So you can check the website. So sorry, it's a bit small, but we have shared it in the Zoom link, so we can find more information at that UGM ID Syarat Pendaftaran UOM, and you can reach out at our Instagram account, and also in that registration website of HPM. There's a phone number you can contact by WhatsApp.
Okay, so hopefully this partnership will last in the years. So don't be discouraged if you are not cannot apply for this term. Okay, so I would ask if any more question from the audience or the Zoom, because we are 5 minutes more is a closing time. Okay, so maybe I would ask for each panelist to wrap up this session. Maybe you have less advice for student for applying, or you want to share something for our audience. Maybe start from Dr. Lutfan first.
I think Melbourne is very nice to study there. So please feel free to contact us, and we'll try to accommodate your preparations to apply for this program. And UGM of course is also good, but we now have a collaboration that actually can facilitate both to study in UGM and at the Melbourne University. Yeah.
Miss Emma, do you have something to?
This is such a great opportunity, and it is so exciting. And I think, we have really fabulous alumni network here in Indonesia with students who have taken our programs previously, and we look forward to growing those alumni networks and maintaining the collaboration and our friendship ongoing.
I would agree with that. We are very proud of this collaboration and this program. We're excited to consider welcoming the first cohort of students to study with us. I would also, as well as our alumni, like to thank those of you who have attended today online and asked very interesting questions and making them to hear more about the program, but especially extend my thanks to those in the room who have attended today. And Emma and I, as a token of appreciation and ours, we have a small gift for everyone who has attended today. So please do see us at the end of the session, and we would love to see some of you in Melbourne.
Yep. Okay, so yeah, looking forward to hearing from you guys all. Thank you.
Okay, plus before you can get the gift, there is a QR code on the and the screen. And for the online audience, please scan the QR. There is a feedback form that we would like you to fill in. Okay. And thank you very much for our panelists, Dr. Lutfan, Ms. Emma, Professor Belinda, and Dr. Like, for today's discussion. It's very enriching and like very informative and for our audience. And thank you for our all the interesting questions. And we are closing our session today. Have reached the end of today's program. On the behalf of the college, I would like to express our deepest gratitude and to our distinguished speaker also, and for all the participants. We hope this session shared today will inspire and guide you who are interested to extend your studies, including this double degree program between the University of Gajah Mada and University of Melbourne. Okay, thank you once again for joining us. Have a wonderful afternoon and see you at the future event. Thank you.